Your Excellencies, distinguished delegates, colleagues, ladies, gentlemen, and students. On behalf of World Information Transfer, I would like to express our deep appreciation to the government of Ukraine for co-sponsoring the 22nd International Conference on Health and Environment, Global Partners for Global Solutions, and the missions of Hungary and Singapore for supporting it. I would also like to express our gratitude to His Excellency Yuri Sergeyev, Permanent Representative of Ukraine, Mr. Thomas Gass, Deputy Secretary General for Policy Coordination and Interagency Affairs, UNDESA, Mr. Nihu Seth, Director of Division for Sustainable Development, UNDESA, our esteemed speakers, and the University of Westchester for bringing a couple of busloads of students, the future of this planet. World Information Transfer is dedicated to the studying the connection between environmental degradation and human health, and in identifying solutions to remediate our environment, and by doing so, improving the health and quality of life of Earth's citizens. Each year, for the past 22 years, I have been reciting a list of accomplishments that have galvanized the global community to attain sustainability. Unfortunately, with all the knowledge that all of us have gleaned, most of our leaders still do not have a deep connection to the Earth, and our planet is continuing to degrade, as well as the health of its inhabitants. The world can get along, as Dr. Robert Solow of MIT stated, without natural resources. So exhaustion is just an event, not a catastrophe. But can the inhabitants? Can we? We have been listening to the ills of our planet since 1972, the first United Nations Conference on Human Environment in Stockholm, Sweden, and have been conscious that we are living at the expense of the future by exhausting the resources that will be needed by the future generations. We continue to contaminate the air that we breathe, fill our land and water with waste disposal, destroy our forests at an unprecedented rate, erode our fertile soil, destroy our ozone layer, and continue to exacerbate our climate and the extinction of millions of species. We thought that environmental problems were attributable to ignorance, inadequate government, administrations, and multinational companies. To some extent, this is still the case. There are countries that lack the necessary technologies due to many difficulties that they are facing, including lack of enabling environments due to the lack of good governance and rule of law and population explosion. Others still profit from the sale of pesticides and dumping of toxic materials in the developing world. We have learned that environmental issues are of international concern and need international collaboration. However, this growing awareness is progressing at a much slower pace than the destruction of our habitat. A social order that was created by cultures without fundamental world justice cannot sustain itself. We need to change the culture, whether one of consumption or one that gives rise to increased populations. Both are unsustainable. Our present civilization, our culture, our values are endangering our world, and it is up to the young generation, those that will lead the future, to galvanize those that are unable or unwilling to attain a culture that will benefit future humanity. That is why I am so proud that each year at our conferences we have large numbers of young people, as they need to hold all of us accountable, since we already live on their expense and those who will come after them. In conclusion, I would like to end with a quote from Jonas Salk, medical researcher and developer of polio vaccine, who, when asked who owns the patent for this vaccine, answered, "Why, the people." Thank you. Okay. I wanted to mention that this session is webcast, also that all of the speeches are going to be on the internet. All you need to do is check with our media director. And at the present time, I would like to introduce Ambassador Yuri Sergeyev, is the permanent representative of Ukraine to the United Nations. Mr. Sergeyev has been the permanent representative since May 2007. Prior to that appointment, he was ambassador to France, during which time he was also permanent representative of the United Nations Educational, Scientific and Cultural Organization, UNESCO. Ambassador Sergeyev has also been the Secretary of State at the Ministry for Foreign Affairs, the Ambassador to Greece and Albania, and headed the Foreign Ministry Directorate for Information. Your Excellency.
Thank you, Dr. Durbach, for introducing me. Dear colleagues, distinguished guests, I am honored to represent Ukraine as a co-host of this essential open dialogue at the United Nations that give us an opportunity to discuss a number of the most relevant items of the United Nations Development Agenda. First of all, let me thank the co-organizers of this event, Dr. Kristina Durbach, and the World International Transfer for being sustainable host and partner for these conferences during the long 22 years. I would also like to welcome our distinguished speakers of today, Mr. Nihil Set, the Director of the UN Sustainable Development, the representatives of the missions of Hungary and Singapore to the United Nations, and our colleagues from academia, Princeton and Columbia Universities, and from the Electric Power Research Institute. Dear colleagues, Ukraine is confident that broad international discussion within the United Nations is a fundamental element in order to frame the national and global priorities for the future development programs of the United Nations. The topic of our conference is sustainability risks. However, let me say a few words that World Sustainable Agenda is a long process, which was started almost 15 years ago. In the year 2000, the United Nations Millennium Declaration defined a global vision of the development in the form of the Millennium Development Goals, MDGs. These goals have a clear system of targets and indicators as well as time frames for achieving them. Reaching the MDGs means real changes in people's living standards. In September this year, world leaders gathered in the Special General Assembly event to discuss the efforts made towards achieving the MDGs. It was highlighted that with the 2015 target date of the MDGs fast approaching, the outcome document should focus on existing gaps and weaknesses of the MDGs, accelerating of implementations and looking forward to the post-2015 development agenda. The country stated that during the past 13 years of two left, we have achieved a lot, especially in poverty eradication and health care. Since 2004, and being the first post-Soviet country to adopt the MDGs, Ukraine has prepared a number of annual monitoring reports. In September 2013, Ukraine presented at the United Nations its third national report on acceleration of MDGs. This publication incorporates the assessments of 200 leading experts from various scientific, economic, and research institutions. It is also available online. Dear colleagues, there is no doubt that every developing nation is striving to reach Millennium Development Goals and incorporate successful achievements into the post-2015 development agenda. It means that in 2015, after the MDGs are achieved, the member states will need the new guidelines for their post-2015 agenda. It means that we need to elaborate the Sustainable Development Goals, SDGs. The UN member states are now in a challenging process of outlining their positions to the issues of sustainable and inclusive economic growth, macroeconomics and infrastructure development, as well as climate change, health, gender equality, and many other topics. I am sure that Director Nihil Set has much more to explain, being the UN captain for the MDGs and SDGs. But I have to add that Ukraine, as well as other UN member states, are now in a challenging process of outlining their key priorities for the potential development strategies for the next decades. I would emphasize that Ukraine supports the activity of the General Assembly Open Working Group on Sustainable Development Goals, where countries can discuss their SDGs priorities. By the way, its fifth session was ended successfully just last week, and Ukraine has presented its view on an energy issue. We are confident that national economies should grow and social standards should rise in the future decades. Therefore, energy should be definitely included into the SDGs agenda. However, energy item for Ukraine's economy is a multi-sided issue and has the diversified approach for the energy supply and production without compromising its sustainability. Renewable energy is becoming an integral part of the energy system. However, because of the cost and infrastructure still remains a challenge. Ukraine's reliance only on alternative or renewable energy sources or burning of fossil fuels will not resolve economic and social development issues in the future. By saying that, I mean that over 50% of energy supply in our country is produced by peaceful atom. We believe that sustainable nuclear energy approach should be taken into account by the member states, especially those which rely on such technology. The new approach must ensure comprehensive consideration of security, social and environmental aspects, particularly in priority areas such as ecological safety, comprehensive environmental conservation, and prudent management. Only such approach will facilitate sustainable development of energy, especially as regards efficiency and safety of its nuclear sector. Having Chernobyl resolution on the General Assembly agenda, we are confident that immense experience of almost 30 years of long activity of how to manage and revitalize the nuclear accident consequences should not be lost for the international community. Dear colleagues, I try to shape the main ideas for the Ukrainian delegation, the United Nations Development Agenda. And now I guess that it is time to listen to the views and approaches of distinguished colleagues here. Thank you.
Thank you, Your Excellency. Thank you, Your Excellency, for giving us an update on the sustainable efforts of Ukraine, which basically has co-sponsored this conference for 22 years. So, before we continue, I would like to remind you that it has been our tradition not to take questions from the floor. Please fill in the questions, and the monitors will collect them, and then all the speakers are going to be able to answer them. Thank you. I would like to present to you now Mr. Nihil Set. Mr. Set is the Director of Division for Sustainable Development, Department of Economics and Social Affairs, DESA. He was also the head of the Rio Plus 20 Secretariat, where he spearheaded the preparations for the UN Commission on Sustainable Development Conference in Rio. With over 20 years of service to the United Nations, Mr. Set has served as Special Assistant and Chief of Office to the Undersecretary General for Economic and Social Affairs, Secretary of the Economic and Social Council, ECOSOC, and the Second Committee of the General Assembly, and as Director of DESA Office for ECOSOC Support and Coordination. Before joining the UN Secretariat, he was a delegate to the UN in the Permanent Mission of India and involved in various UN conferences and summits, including the Rio Summit on Environment and Development, the Copenhagen Summit on Social Development, the Monterrey Conference on Financing for Development, the Mauritius Conference of Small Island Developing States, the Millennium Summit, the World Summit on Sustainable Development, and the UN World Summit. Mr. Secretary.
Thank you, Christine. Ambassador Sergeyev, distinguished other representatives on this podium, all you young people out there, ladies, gentlemen. I've been coming to this conference now for several years, and it's such a pleasure for me to be with you and to interact with you and to learn what are your concerns and your priorities. I can, of course, bring to you what are the kind of priorities that the UN is focusing on and how we are looking at this rather complex issue of sustainability as we go ahead. As you know, as Ambassador Sergeyev has mentioned, we did define a set of goals some years ago, 13 years ago, which were called the Millennium Development Goals, and they focused on the basic human deprivations. They focused on issues like poverty, on hunger, on health, on education, on gender equality and empowerment, of environmental sustainability. But what I would challenge you all is to think of the poorest person you've ever known, and to think, what are the forces that act on this person which prevent him from moving up by giving a life of dignity, a life of respect, a life where his hunger, his other needs are taken care of? What are the complex forces that act upon this individual? I'm giving you this challenge only because I want to help you find a segue into what the UN is doing of defining a post-2015 development agenda, which not only looks at the minimum deprivations as we defined in the MDGs, but we go much beyond. And in doing so, let's look at the individual. Let's look at this poor person, the poorest person you've ever met, and let's look at the forces which are acting on him or her. Now, clearly, of course, it's poverty, it's income poverty, it's hunger, it's education, it's health, lack of facilities, access to health facilities. It's the environment that is working against him. It's the oppression, the inequalities that they face. It's the discrimination that is faced in many communities in poor parts of the world. But there are a whole set of other forces acting on the individual. It's the environment he lives in, the kind of sanitary facilities, the availability of water, poor air quality, the threat to life and limb, the lack of security. These are the second set of forces that are acting on this individual. And there are a third set of forces acting on this individual, and these are called the slow onset events. Events like climate change, events like the sort of state of our oceans and what that is doing to the availability of protein and nutrition to them. It's the loss of biodiversity. It's land degradation. So you have these three sets of forces which are acting, which are preventing this person from breaking out from the cycle of poverty and deprivation and to moving into higher trajectories where that person can enjoy a life of dignity. So how do we address these challenges? How do we make sure that by 2030 and beyond, none of these forces operate on this individual, where the individual can break away from all these deprivations to live a life of dignity? And for that, the UN is now grappling with what they call the Sustainable Development Goals. Goals which go much beyond and look much more deeply into these issues than the Millennium Development Goals did. And here, I want to come to the concept of sustainable development, because sustainable development essentially looks at these forces which are economic forces. These are forces which meet the economic aspirations of individuals. There are the social forces, social aspirations of people to move up on the social ladder. And of course, there are these other environmental forces which prevent that individual breaking out. So it's this intersection of economic, social, and environmental forces. And unless they are seen in their totality in a holistic way, we are not going to succeed in breaking out from this trap of poverty and deprivation. So sustainable development is a tool to look at in an integrated way of decision-making and other processes which will meet people's economic aspirations, because that's at the core of what motivates people, their economic aspirations, to look at their social aspirations and to look at their environmental fears together in a holistic way. And that's what we are trying to do in the Sustainable Development Goals, to look at the whole series of issues, the intersections of these issues. It's for these reasons that I'm very happy that your topic today focuses on two crucial issues, on health and the environment, because these are very closely intertwined and you can't discuss one without looking at the other. And we know what these intersections are, but it's our ability to see these intersections more forcefully and in all the kind of cross impacts they have on each other, the negative and the positive spin-offs that they have on each other, which is so crucial. And I see from your program, you have a rich program where you're looking at different facets of these intersections. So the way in which you discuss these, the way in which you see these, the way in which you develop ideas around these intersections, that is the core of sustainable development. So it's very important that while you're looking at sustainability issues, on the issues of environment and health, you do explore all these issues. Now let's look at what are these intersections between environment and health, and how can we have a mutually reinforcing process where taking actions on the environment, taking actions on health will be mutually supportive to each other. Let's look at local issues. I want to go into the global commons issues like climate change and oceans and land deforestation, loss of biodiversity and so on a little later. But I wanted to first look at the local impacts of what are the forces, intersections between environment and health. First, I think in large parts of the world, sanitation is such an important issue. And open defecation, the billions of people who don't have a toilet, and what that does to the local health is appalling in terms of dysentery, other diseases, the deaths that causes, how all this gets into the water system, and the kind of impacts that have. So I would say clean sanitation, safe sanitation is one of the most important environmental intersections with health. The second, it was mentioned, I think, by the ambassador, that the whole issue of waste management, particularly in cities, is going to be a very important determinant of the sanitary conditions in which people live. The third is air quality. We know how, for example, issues like motorized transportation, factories using not very clean processes of production, what that does to the particulates in the air, and how that impacts upon health, the respiratory health, the rheumatology, the illnesses which are generated by this lack of clean air. The millions of women and children who die because they use not clean cook stoves, they use biomass for cooking, and what that does to the smoky environment in small homes and the impact that has on people's lives and that quality. Then, of course, the whole issue of water quality, the issue of chemical pollution, the issue of the kind of urban congestion we live in. And remember, as we look to the future, because this, of course, sustainability is your agenda. It's an agenda for the young people. It's an agenda for the future generations. And as we look 20, 30 years into the future, urbanization will be one of the most strongest trends in changes in the way people live and work, and how that is going to impact on the infrastructure of cities, and how all these things that I mentioned on sanitation, on water, on air quality, and on chemical pollution, on particulates in the air, how all those are going to make, in a large part, particularly of the developing world, urban hell for people to have a healthy and healthy life. So these are forces that will be acting at the local level. And on many of these solutions have to be local. They have to be done by the mayors, by local governments, by municipalities, by citizens groups, who have to focus on the ways in which the air quality has to be improved, in ways in which the water quality has to be improved. So these forces are going to be acting very strongly. So these are the local manifestations of the impact of the environment on health. Then we look at the global issues like climate change, what that's doing to vector-borne diseases, increasing temperatures, and what that means for malaria, for example, and what that has to do with water availability, and so on. So there's a whole set of issues which are generated by our lack of taking serious action on mitigating climate impacts and how that's impacting on local health. And this is an issue which is not given as much prominence as it deserves. When we look at climate change, we normally switch our minds totally to the water issues, which is on melting ice, on rising sea levels, on extreme weather events. But all these have deep implications on human health, which must not lose sight of. And on oceans, what we are doing by overexploiting our fish stocks, by making less protein available to people, and what that means for nutrition and health. So there are lots of intersections, whether you look at global issues or you look at local issues, and the impact that has on human health. So health is at the core of sustainable development. It is a right and a goal in its own right. It also means, it is also a means of measuring success across the whole sustainable development agenda. That's why it's important for a meeting like yours to bring to the governments the importance that the health agenda is in meeting the needs of the future we want, to meeting the healthy needs of our future generations. Health encompasses broad well-being. It's not only the absence of diseases. Universal health coverage and equitable access to quality basic health services are issues raised by many governments and by non-state actors. Other important issues which have come up in the UN's consideration of how to look at sustainable development goals are health promotion, prevention, and treatment. Communicable diseases are still a burden in many countries, but non-communicable diseases increasingly affect all countries, highlighting the need to promote healthy diets and lifestyles. There is a need to address access and health needs of persons with disabilities. The discussions that are taking place between governments have highlighted the importance of equal access of women and girls to healthcare services, including addressing women's sexual and reproductive health and ensuring universal access to safe, effective, affordable and acceptable modern methods of family planning. Aging populations is the other big demographic trend, which is posing a major healthcare challenge in many countries. There is a overlap between health risks facing the young and the old. So how do we break through all this? How do we get these intersections? We should focus on getting basic health services to all. We should focus on global partnerships for health and for the environment. We've tried over the past so many years to integrate these economic, social, and environmental issues into this theorem of sustainable development, but the time now has come. And I think your deliberations here, your ability to bring these forces together, to break down the silos which have often helped look at environmental issues separately, health issues separately, education issues separately, inequalities issues separately, to bring them together in a comprehensive and an umbrella sustainable development goals and a post-2015 development agenda will help shake up the governments into viewing things differently, of reorienting their decision-making. So I hope that your wonderful agenda today and your ability to look at different aspects of this problem will enrich the way in which governments also will ultimately look at these issues. And I hope you do find a way. You're a consultative, you've got consultative status with ECOSOC, and I hope the World Information Transfer will be able to bring the messages you hear at this meeting to the relevant bodies to make sure that in our pursuit of this overarching agenda for the future, for the next 30 years, we have these perspectives brought together in a sensible and meaningful, policy-oriented way, in a way which inspires policymakers, which inspires people, which inspires communities, and brings about the change that we want to see in the world. Thank you, Christine.
Thank you, Mr. Seth, for a very inspirational presentation on all the forces that prevent changes in achieving sustainable development. We hope that we will be able to mitigate some of them shortly. Our next speaker is Mr. Martin Johnson, is the founder and president of IOS Incorporated, a 32-year-old self-help urban green development organization based in Trenton, New Jersey. IOS has received national and international recognition for its sustainable development work, including planning and development, wealth creation, urban agriculture, environmental health, education, and training. Mr. Johnson is also a founding director of the Success Measures Project, a national effort to develop impact measures from community building work. He is a graduate, a former trustee, and executive committee member of Princeton University, where he taught at the Woodrow Wilson School of Public and International Affairs. Mr. Johnson.
Thank you, Dr. Durbeck. Good morning. It's an honor to be here for the first time. For roughly 40 years in the United States, there have been community development organizations. These are NGOs, non-governmental organizations, engaged in work in communities across the country. Up until the recession, there was about 3,000 of these organizations, and several hundred of them have gone out of business since the recession. But this is an interesting moment in time to take a look back and to see what the impact of those organizations have been, how they've been managed, and how to bring this to the next generation, which is going to connect us to the health and environmental issues of the conference today, because there's a growing number of groups out there, including our own, that are rethinking the way this has been done for all those years. And I appreciate the opportunity to talk about this. So what's been the results of those organizations across the country? Well, the record is fairly mixed. There's been some organizations that have done a very good job, but they're primarily focused on housing, which means that when you're in the midst of a recession like the one we've just experienced and the land values get hit hard, that those organizations get hit hard. It also means that they're not addressing, if they're just addressing housing, they're not addressing other critical needs in those communities. And so the notion of these communities as complex systems sort of flies in the face of organizations that have focused in on just one part and hope to do redevelopment with just a focus on this one issue, like housing development. So ISLES is an organization that engages in housing development, and we do it in places that are important. So we just have a little different mission. Our mission isn't to build homes for people that need it. Our mission is to foster self-reliant families and healthy, sustainable communities. The 9-word mission, those 2 buckets, family self-reliance, healthy, sustainable communities. So at the end of the day, at the end of the year, that's what we care about. The things that we do over 32 years of asking the question, what's the most powerful, cost-effective way to get to that outcome? Those things involve developing homes. As you can see some of the images here, we develop parks, we develop urban agriculture gardens. Go ahead, keep going. We also have, the previous slide showed self-reliance activities. So we offer these products and services. Some of them are focused on financial services for people who get into debt. We have some interesting financial products. We also work with people to train young people who have dropped out of school. In Trenton, for example, only 48% of the freshmen in their high school will graduate in 4 years. So we have this enormous challenge of finding new ways to educate these young people who are having enormous impacts on our neighborhoods. We also are training them in the construction trades. We also have a green job training facility. So for adults who have a high school diploma, they're learning how to install solar panels and provide energy efficiency work in buildings, weatherization in buildings. So why do we care about this stuff? Why do we care about urban areas and sustainability? Well, more than half the planet now lives in cities. High-density communities, like cities and older suburbs, have the lowest carbon footprint. So the most energy-efficient house out in the exurbs with the family driving a Prius has got a larger footprint than folks in the inner city that can walk back and forth to work, to the schools, to local stores. Unhealthy cities, especially in places like New Jersey, are driving sprawl. So families are fleeing these areas, and I'll talk a little bit more about that flight. But that is gobbling up the open spaces, and people are continuing to vote with their feet and moving out into places where it's making it harder and harder to provide public transit and to deal with the sustainability issues long term. We also have an interesting political alignment that's happening, which is families are fleeing the inner cities, moving into first-ring suburbs, creating opportunities for both the first-ring suburbs and cities populations to come together. It's been an interesting thing to witness what has happened at the federal level with the Obama administration and where politics are aligning there around the suburbs and the critical nature of these swing districts. But for a variety of reasons, it's important that we link the suburbs now with inner cities. This gives you just a quick glimpse of what's going on in our town. The bottom yellow line is Trenton's population going back from 1940 to today. You see the depopulation of the city, and the top bar is showing the suburban growth in our county. This is the picture of sprawl, if you will. Luckily, it's bottoming out, it seems, but that's entirely because of international immigration. Okay. From an environmental health perspective, we have found some extraordinary environmental challenges through our work over the last 32 years, and we are focusing in on trying to find ways to eliminate these threats. In particular, by far the most dangerous place for a child to be is in their home. And so we'll talk a little bit about why that is the case, especially with the access to lead in homes. We have tested now roughly 3,000 homes in the city of Trenton alone, and this is almost a little more than 12% of the total number of units. These are cross-sampling, not just units that are in poor condition, but this is middle-class units as well, and we found that roughly 66% are too, in effect, poisonous for children to be in because of levels of lead in the home, in the dust in the homes, right? So this isn't children just chewing on baseboards getting poisoned. Their piece of cheese is falling on the countertop. And so this is an important issue. It's not from industrial sites that the primary source of this lead poisoning is going on. Go ahead, next slide. In the current school system of Trenton, New Jersey, roughly 38% of all students are lead poisoned. So it's impacting their IQ. We also have heat islands, which perhaps some of you have seen before. This is where the absence of vegetation and thermal mass shows, if you look at this screen, the dark brown areas are roughly 10 to 12 degrees hotter at the same time as those areas in the blue. If you go to the next slide, and you can overlay the vegetative index with this, you can see why these areas are so much cooler. The green areas are cooler, the darker areas are not. If you were to overlay the income of these neighborhoods, you would see those poorest neighborhoods are the hottest neighborhoods, and the implications of that are perhaps self-evident for utility costs as well as for behavior outcomes. Go ahead. It's important for us to find ways to cool cities. We train young people in the construction trades while they're getting a high school diploma. We care a lot about life skills training, and we're doing both online and offline academic training for them as they're engaged in community development in their neighborhoods. Go ahead. We have a financial solutions arm to the organization. You can't talk about self-reliance without talking about money, and how to build assets is our primary question. We're very interested in promoting savings accounts, home ownership, as well as helping people get out of debt. We have another arm of the organization that's focused on green job training for unemployed and underemployed workers in particular. Go ahead. And then we run a subsidiary arm of the organization, which are local people that have been trained. They're in box trucks going around and renovating houses, making them energy efficient. But where it gets really interesting is where we can combine the cleaning up of the houses, eliminating the lead threats, and doing the weatherization at the same time. The scopes of work are related enough that in a very cost-effective way we can do this, which should be done 10 times more quickly than is currently being done in Trenton and should be done elsewhere around the country. And then finally, we have an arm of the organization focused on community planning and development. This is involving community people in decision-making in their neighborhoods. What should happen here? Not just from a land use perspective, but from a social services perspective. We also use master planning as a way to train people to make decisions as a group, to understand that the loudest doesn't win, to understand what the implications are for decision-making long-term, and then to help implement plans once they're made. Green buildings and parks for us is a way to focus in on the long-term cost reduction and increasing quality of life for people so they don't have to flee. We've done about 400 homes in the city of Trenton. We've converted some former factory buildings into mixed-use facilities. This one here, we're going to begin construction in the next 2 months. Mixed-use building that will be residential as well as a nonprofit center along with artist studio spaces. We have an urban agriculture arm. We have 60 school and community gardens that are basically raising food on vacant land. Since cities are depopulating, it does create the opportunity to grow tens of thousands of pounds of food now in the city, which has an important impact on public health outcomes, especially child health outcomes. Yes, we do bring oxen into the city, as you saw in that image. So what? So how do you manage organizations that are no longer focusing in on taking care of poor people, but focusing in on self-reliance? How do you manage staff who really want to do stuff for people, but if they really need to do stuff for people, you know, they might have to find another place, because we need to focus on services and products that people choose to use, and those services and products are going to foster self-reliance. And so that means that we don't even talk about, we've tried to extricate the word program from our lexicon as an organization. We talk about products and services, not programs. We talk about not just local work, but we talk about those regional forces that are out there that are undermining local work. You can't address some of these problems just by working locally, which means we've set up a nonprofit organization that's statewide in New Jersey to organize at the suburban level so that leaders from the suburbs can come together with leaders from the cities and make decisions and address those regional forces. We have to be able to not just do stuff. It's important to do stuff, but the real magic here is in the learning. So that's the thinking process. We don't get funded typically to think. We get funded to do things. So our job is to be as smart as we can while we're doing things and be able to manage data, be able to manage contracts. We're using Salesforce.com now. We're integrating it across the organization and coming up with better success measures as a result of that. We also have the only way to have integrity in this work long-term is to not rely on any one source of funding. So that means we have 300-plus different institutional sources of funds, private and public. Less than half of our money comes from the public sector, and that gives us the ability to keep our eyes on the prize. We also have to think more about growth in economies than just the same old economies of scale. It used to be if you increase your production, your unit cost is going to go down. Economists understand that pretty well. But there's something else going on here, and that is that by doing these multiple services under one roof, there are economies of scope. It's a lot simpler to have one president of all of these organizations under the one umbrella, and those activities bumping into each other so that we can learn how to integrate the health of the homes with the energy efficiency of the homes and training local people and then training young people in that process. It becomes much cheaper to do it this way, but we don't understand it well enough, so that our success measures are going to have to be better developed. And then finally, the role of the environment. It's very important for us to not separate out critical issues, development, people who are in need of these critical issues from the environment. It allows us not just to improve health outcomes when you're taking away the environmental hazards, but it also allows us to connect up to the environmental community, NGOs that are a lot more powerful than we are. And then finally, there's the key decision points. For us, we have to take ideas, as you can see at the bottom of this pipeline. What are the best ideas out there around the world and around the country? And then how do we move those into developing services? And then finally, what is our contribution to a broader change agenda? That's the technical assistance to others, the policy changes. And I appreciate the opportunity to be here with you today. Thanks a lot.
Thank you, Mr. Johnson, for sharing with us the multifaceted work of Iowa's speaker. Is Ambassador Thomas Gass, is the Assistant Secretary General for Policy Coordination and Interagency Affairs at the Department of Economic and Social Affairs of the United Nations. Ambassador Gass was appointed as Switzerland's ambassador to Nepal in 2009 and the country director to the Swiss Agency for Development and Cooperation. In Nepal, he was the chair of the donors to the Nepal Peace Trust Fund, the main instrument for international support to Nepal's peace process, and the co-chair with the UN resident coordinator of the Donor Coordination Group. He also served as the Dean of Diplomatic Corps in Nepal. Prior to arriving in Nepal, he served as the head of the Economy and Development section of Switzerland's mission to the United Nations in New York. Ambassador Gass.
Thank you, Dr. Durbach, and Excellencies, Professors, ladies and gentlemen. Allow me, as we are getting to the closing of this conference, to express particular thanks to the government of Ukraine and the World Information Transfer Organization for this initiative and its substantive and refreshing and enlightening contribution to the follow-up of the Rio+20 conference and the shaping of the post-2015 development agenda. Today's conference has touched on vital aspects of the economic, social, environmental dimensions of sustainable development, including sustainable energy, sustainable sanitation, sustainable health, technology for sustainable development, and food insecurity. As my colleague Nikhil Seth pointed out in his opening remarks, this conference helps give concrete form to the term science policy interface by bringing experts and intergovernmental policy shapers and policy makers together in a space in which we can draw lessons from concrete examples and initiatives. One of the important lessons of Rio+20, which is being reiterated in the deliberations of the Open Working Group on the Sustainable Development Goals, is that the 26+ issues that were identified in the Future We Want outcome document, including health and the environment, need to be discussed and tackled concretely through partnerships in a cross-cutting manner. This was also very much the spirit of today's discussions. Out of today's conference, I see the reaffirmation of a clear health-environment nexus that intersects with other nexuses that have been identified and discussed elsewhere, such as the water-energy-food nexus. Health for all in a sustainable, salubrious environment can only be achieved if there is sustainable energy for all, sustainable water and sanitation for all, and nutritious food for all and access to relevant technology. Health cannot be isolated from all these other factors that influence human health, which in the prosperous parts of this world and the prosperous parts of poor countries are taken for granted. Health and the environment and partnerships for their promotion need to be an integral part of the post-2015 development agenda. By mid-century, we'll be living in a world that may have grown from the present 7 billion to some 10.3 billion people. Already the world population is consuming 1.5 times the annual capacity of the Earth to regenerate itself. We are depleting natural capital rather than regenerating it. Alongside the overconsumption by the fortunate in both rich and poor countries, over 1 billion people are severely deprived in terms of basic needs for health, food, water, energy, sanitation, and education. Accelerating climate change, now confirmed with 95% certainty by the IPCC to be caused by humans, is putting the present and future livelihoods at risk. Increasingly frequent natural disasters, food shortages and rising food prices, scarcer water and deteriorating soils are affecting health and well-being of people everywhere, but most severely in the poorest countries. Accordingly, member states of the UN, as well as major groups and other stakeholders, are relying on 5 guiding principles for the post-2015 development agenda. Firstly, leave no one behind. Secondly, keep sustainable development at the core of the agenda. Thirdly, transform economies for jobs and inclusive growth. Fourthly, build peace and effective, open, accessible institutions for all. And finally, forge a new global partnership. At the center of the post-2015 development agenda are expected to be a set of sustainable development goals, the goals of the new development agenda, will need to build on the progress achieved through the Millennium Development Goals, as this was reminded by several speakers today. The Millennium Development Goals have inspired the world to reduce by more than 1/2 the percentage of those living in absolute poverty. Yet, inequality across and within countries, including in access to health and a clean environment, has increased since the dawn of the new millennium. We need to finish the job started by the Millennium Development Goals so as to ensure the social inclusion of all those who are deprived and to protect future generations from deprivation. The new development agenda will need to give special attention to ensuring jobs for all, including, in particular, youth who in some regions face over 50% unemployment. The new development agenda will also need to heal the planet by counteracting the depletion of natural capital through decoupling economic growth from natural resources use. Health for the planet is invariably and directly linked to health for humans. The acute economic and fiscal crisis that most regions face today is leading to reductions in the social safety nets and on which many people depend, including in key sectors such as health and education. Health and education are often the first victims of fiscal austerity in both poor and rich countries. Today's event should play an influential role both through its outcome as well as the work of the individual countries and organizations represented here to ensure a health and environment-sensitive post-2015 development agenda with a set of global partnerships to implement it. Thank you very much.
Thank you, Ambassador Gass, for a very comprehensive summary of the session.